you changed about discuss about any life anything in your life you want to change. Today, the first question would be anything in your CV you would like to change, and we can just discuss that question. We can just go ahead with that question, and after that, you can just suggest two questions you want to discuss. Just write in the chat box. I'll just give me 2 minutes. Like everybody can join, then we'll start with the meeting. Thank you so much for joining.
Question? Sorry, you muted.
You are muted, Ayushman.
I'm sorry. Yeah. So the first question is, if you have to change anything in your CV, what would that be? Yesterday we discussed if you want to change anything in your life, what would that be? But today it's your CV. Like if you want to change anything in your CV, what would that be? And you can just type other two questions you want to discuss. And like you can even type 3, 4 questions. We'll just quickly discuss all of them. Yeah. So we can cover as many questions as we want as we can in a minute.
Okay, thank you.
Okay, anybody wants to answer? What would they like to change in their CV if are given a chance? Yeah, go ahead, Dr.
Hi, and everyone. I want to answer this question.
Go ahead, Dr. Sapta. Yeah, thank you.
Am I audible?
Very well. Yeah.
Hello.
Yes, Dr. Sapta, go ahead with your answer.
Okay. Okay. Thank you for asking these genuine questions. To be honest, I'm feeling satisfied about all my achievements so far against all the odds. However, I have a wish of publishing and writing some chapters in pediatric books like Nelson's and all referral book. So far my CV is lacking in that. So I would like to add that point to my CV in a near future. And another point I want to talk that I have attended more than 20 national level conference in my home country in India in pediatric. But so far I uh, haven't got get any opportunity to attend any conference and presenting poster in American Academic of Pediatric. So definitely I'm interested to do that in near future. So I think that 2 point I want to add in next one few years at least.
Yeah, anybody wants to give a quick feedback, then we can shift to the second question. Dr. Suresh, do you want to say anything? Okay, anybody wants to answer this question? If they have to change anything in their CV, what would that be? Yes, Dr. Ayat, like what you want to change? Like it can be like if you want to remove that experience or if you want to add something, what would that? You can go ahead with your answer. If anybody has to add anything, like you want to answer this question, it's a genuine question. They can ask you like if you have something.
Even I think I can add another point that
Okay.
I have seen many Spanish speaking Spanish speaking patient during my US clinical experience. And so far, I don't have mastery over Spanish language. So I would like to learn that language in near future to make the communication part more impactful and effective. So I want to add that to my CV.
Okay, perfect. Okay, so I'll answer this question. If like if given a chance, I want to change something. So yeah. So thank you so much for asking this question. So if I am given a chance to change anything in my CV, I would go back and take my step one exam well prepared, and after well researching about the exam, so I might score better in that exam. So if given a chance, I would work on taking my step one exam again. Yeah. So that would be my answer. Anybody wants to give a feedback or add something, or go ahead with your answer? Dr. Sunil, you want to answer?
Personally, is it okay to say that I would not like to change anything in my CV? I'm totally happy with what I am. There are multiple things which could be changed for every person in their life, but some things which are, only some changes you realize only retrospectively in your life.
Yeah,
So
that would be a good answer. Like you can just frame it in a way that I feel even if I had a very low points in my CV that I regret about, but I learned something from that, so I don't want to change anything. I prefer not to change anything in my CV.
yeah, and I mean, I think for everyone, I guess for most people, you just realize these things retrospectively. I mean,
Yeah,
yeah, it's like something, there are multiple things since your childhood you can change, but I mean, the tide is gone. You can just, learn from it and make sure that you in similar circumstances don't happen in future.
oh, yeah, absolutely, absolutely. Like even to be honest, I don't want to change anything, and I don't even want to talk about my step one exam or its score during the interview, and I don't have anything to change. So even I might answer like I don't want to change anything in my CV because like I am contented with everything I have so far. But yeah, so Dr. Surya, do you have a good answer to this question?
I suppose I'll also go with the same thing that I mean, first you have to validate his question, and then you can say that um, I don't take any regrets with me, though there would be a lot of mistakes in my life that at some point I would have thought about that I would have not done that. But now, as in future or in present, when I see those mistakes, I feel like I have learned a lot from those mistakes. And if I would not have done those things, I would not have be at this stage, or my personality would not be of this kind. So I do not want to change anything from my CV or from my experiences because of all those experiences, I am today what I am.
Perfect answer. Yeah. Anybody else wants to give an answer to this question? Ishan, do you have an answer to this question? Like this participate, it's okay. No answer is going to be wrong, and no answer is going to be perfectly right. Right? It's okay. Nobody can give bad answers like me every time, but yeah, you just have to participate so that we can continue with the meet.
Aisha,
Okay, right now, Dr. Swarna will go ahead with her answer. Then we can just take answer quickly one by one. Yeah. Thank you.
Okay, sure.
Okay.
Thank you. So actually, I had a question to this question, as in, you had mentioned that is there anything that I would want to change in my CV? So does it also mean that since they had limited the experience to 10, if it were more than that, I would like to add a few more from what I had already done. Would that fit in as an answer for this?
I believe that they're not going to say that is there anything that you want to change from your CV, because that would be a limited question. If they would ask you a question that you want to change, then it would be regarding your personal life or personal experiences, that anything that you want to change in your life, or if you get a chance to go back in your life, then what would be the thing that you need to change? So the question will be related to you and your personality. I don't think so. They're going to ask about particularly from the CV that is there anything that you want to change in your CV?
Okay, got it. Thank you for the clarification.
Yesterday, Dr. Suraj, like we discussed this
Welcome.
question, if you want to change anything in your life, then everybody give their perfect good answers. But today, like the question that I saw was, if you want to change anything from your CV particularly, right? So like to be very honest, I don't have anything particular in my CV that I want to change. Like I'm grateful for whatever I have and I learned from it. Even if there were the low points, I learned from that. But yeah, specifically from CV, like when they ask from the CV, we cannot tell it from the life experiences. We want to change something.
Yeah, I mean, I would be giving the same answer to both of the questions. The question, if they ask like from the personal life, apart from CV, then of course the answer will be more detailed. And if they are just particularly asking for the CV, then again, the main idea will be the same that then I don't think that I want to change anything in my CV because these experiences, I have some mistakes from which I learned some things, and I inculcated those things in my personality. So I don't want to change anything from my CV.
Good, fine.
Yeah, go ahead, Dr. Khulud. Yeah.
No, oh, sorry. I want to be on mute. I'm outside. I'm at clinic.
Okay. Yeah. Anybody else? Dr. Mohammed, you wanted to answer the question? Go ahead with your answer.
I want to ask.
Oh, yeah,
I want
Doctor.
to answer.
Yeah, go ahead, Doctor.
Yeah, I want to answer this question.
But go ahead, go ahead.
I can change some.
I think there's a problem with your network, or like my voice is breaking on my side. It's not audible. Dr. Michael.
Sorry.
Or anybody else can answer till Dr. Michael can just recheck his network. Dr. Alisa, you want to answer something?
Yeah, Ayushman.
What is your question? Can you please
What's
repeat
the
the
question?
question?
Yeah,
Okay,
can you repeat the question?
yeah, the question is, if you have to change anything in your CV, what would that be, if given a chance?
Can I answer?
Yeah, sure. Go ahead. Yeah, go ahead.
So, I would like to change one of my experiences out of the 10 experiences because I didn't have the chance to write my hobbies over there. I could have switched one of my tele rotations, an older tele rotation which I'd done 2 years ago, to my hobbies. So I could just divert my interview towards the hobbies. Yeah, that's it.
No, we'll
Hello?
eventually direct it to hobbies.
Yeah, anybody wants to give a feedback, Dr. Sunil?
No, I'm just saying that if he answers this way, the next question would be what hobby would you like to enter? I mean, just that
Yeah.
should be a follow-up question for this.
So maybe if they ask in particular to the CV and someone who has short time of clinical experience in United States or something like that, so we might answer it like this: that if I were to change something on my CV, I would have pursued more more United States clinical experience. I believe this would have given me a broader range of practical skills and more exposure to the United States health system. If someone has less opportunities for United States, or if somebody has just 1 month or 2 months observerships or electives in US, so you people can add this answer that if I were to change something in my CV, I would have pursued more observerships or more exposure to the United States healthcare system so that I would have a broader range of practical skills and more knowledge about the US healthcare system. I mean, it does not go negatively. So you are just showing them that if there would be more time, so you would have gained more knowledge. So yeah, but don't share about your mistakes. I mean, don't talk about your regrets that this was my regret in my past and I want to change that. So you don't have to do that. Don't talk about any regret in this question.
And Dr. Suraj, like if somebody doesn't have a clinical experience at all, like do you think it would be a wise idea to talk about that during the interview?
If he has clinical, I mean, US clinical experience, maybe you can talk about, but I don't think so. They should talk about the home country experience.
No, I mean to say somebody doesn't have a United States clinical experience at all. Like would be a nice idea during the interview that you want to bring up that you don't have a USCE and you want to do more. If given a chance, you want to do it.
That's a tricky thing now. I mean, some programs they write on their website that we prefer United States healthcare. Clinical experience, and some programs they don't write anything about it. So it's gonna be a tricky thing.
But I also kind of feel like if they are extending you an interview and you do not have a USCE, that already means that they have gone over your application and they found something else attractive. Like, of course, like these are the basic things that people go through when they send you an invite. So it's like you can talk about it, but if you necessarily do not have anything, I don't think bringing an attention to that one particular thing is, almost always nice. But at the same time, if they gave you an invite, they already know your deficiencies, right? Like they're okay with a lot of things in your application.
But like if I would be interviewing, I would never bring up directly from my side that I don't have a USCE, because you never know. Like I won't bring it from like upfront. I won't bring it. Yeah, if they want to discuss, then I'll discuss about it, like why I didn't do any United States clinical experience, but not from my side that I'll start a conversation that I don't have. Like in my case, I have a low step 1 score and not a very good step 2 score as well. So I would never bring it from front that about my step 1 discussion. Like I told, if I want to change something, I would that would be step 1 score, but I would never bring that in my interview as well. Like I don't want to show myself in a little low light. Yeah. So Dr. Ishan is saying that about his answer. Anybody wants to talk about that? Then we can shift to the next person.
I really like his answer about the hobbies thing, because a lot of us have not mentioned hobbies as we are limited to the experiences. So I think that's a good question. Also a good follow-up question could be asked, and we'll be good with, it will give us few minutes more to talk about, 2 minutes more. So it's really good. Yeah.
Thank you so much, Dr. Kuluk. So anybody else wants to change something? If want to answer this question, if you have something to change in your CV?
I wanted to ask you a question. Actually, I am an old graduate. So while answering this question, should I mention regarding my graduation year, or should I totally skip that? If they ask me, should I only answer to them then, or should I explain myself why I'm an old graduate and what did I do in this time period in this question?
People already, I mean, the interviewers know that you are an old graduate, because I think, in the ERA CV, there is a spot for writing the year of graduation. So I don't think, like, for this question, this would be like the year of graduation would be an appropriate answer.
Okay.
And maybe they will themselves ask you about your gaps separately. Maybe they will ask you more about your gaps separately, about your CV, so you don't have to mention it here. But if they ask you about what you did in all these years, you have to be prepared for that.
Okay, thank you.
So yeah, just one thing to mention is that last time in a meeting we had the similar discussion about the older year of graduation and our red flags. So So at that time, somebody told that interviewer can be blinded. It can be, single blinded interview as well. Like he doesn't know anything about your CV. He's just here to interact with you, and he's going to judge. Like he has been given a candidate, and he's going to judge you from your interview. Like he's going to rate you from your interview. So sometimes, like there's a chance that interviewer doesn't know anything about you. So, like in that case, like we should avoid bringing our red flags up front unless and until they ask us, right? Like my year of graduation is 3 as well. I'm applying. That can be considered kind of like I am older grad again, like not very old grad, but yeah, still. Why 3 years? If unless and until they don't ask me my year of graduation, I won't. I would prevent myself from mentioning my year of graduation to them, or maybe my low step one scores or the decent step two scores. Like I won't talk it upfront about my scores or my year of graduation. So I think if if I want to tell, like I think we should prevent talking about these red flags
Yeah.
upfront unless they ask us.
So many people also learn new language here. Being in US, they start learning French, Spanish, so they can say like new language. And I did not mention. You can mention that I am learning French. I did not mention it. Something like that.
Yeah. Okay. Yeah. Absolutely. So, Dr. Ayat, go with your answer.
Thank you. If I were to answer this question, I think I would say, thank you for answering. Thank you for asking me this question. If I were to change something in my CV, I would pursue, like the other doctor said, I would pursue more US clinical experiences. Other thing, I think I'm looking forward to have my 2 papers to be published, which are in the process of writing right now and editing. Yeah, that's all for me. Thank you.
Yeah. So next,
I have a question. Like, if you don't have the right amount of exposure in handling the EMR system, so can we like talk about that, or it will be like a negative point for them? Like usually in observership, they don't give you that much exposure to handle the EMR like independently. So
I don't think so. Talking about less exposure to the EMR would be a better thing. Just talk in the broader ways. Yeah, don't go for the specific things. Maybe just talk in the broader way. That's it.
I mean, it's a good idea to not talk so much negative about yourself, I believe personally, because the way you are projecting yourself, it shows that your self-worth. Because a lot of IMGs, they don't have access to clinical rotations which allow EMR access. 90% of them, I would say even. So I mean, this is not a big negative that you should bring it up. Like, I mean, go for something like that will make you look in a positive way. I believe the perception should be positive, something that you would like to change. Like that's
Yeah, I agree with Dr. Deshmukh because you have to try to sell yourself. At the end of the day, like I know they've given you an interview, but like there's no guarantee, they would select us. So like sell ourselves, I think it's better to say positive things about our CV. Like I mean, unless they specifically ask like what do you think is your red flag in your CV, I think we can say like this and this. But like for Dr. Sapta, I think you can say like the hobbies is a good thing because it can steer the conversation to that part of your CV. So yeah, I think EMR thing, it's better not to like mention it.
Yeah,
okay.
even I agree with that because when you are interviewing, one thing that they really care about is whether you're a whether you're gonna be a good resident. So if you're saying you're not good at like one thing that residents do most of the time, like even though most people would not know, you're just making it very obvious and it sort of will stick out, and they might choose another candidate over you simply because of that, I feel.
Like you don't have to be brutally honest. You have to be smart. Yeah, and you have to sell yourself. That's the trick. So yeah, so it's like till 9:40 we'll take this question. The next question we'll shift to is if money can, what money cannot buy. What do you think if money can buy? Like related to money, I just wrote in the chat box. The question is, just give me a second. What do you think money cannot buy? So we'll go with this question after 9:40, after taking the answers, and you can just prepare like those who have given the answer and want to answer the next question. You can just prepare in your mind. What do you think money cannot buy? Yeah. So yeah, Dr. Anjali, go ahead with your answer.
Yeah, thank you, Ayushman. So, yeah, I agree with all the answers. Like, one of them is USC and one of them is research. But how I'll answer this question, depending on the program. If it is a community program, I'll tell more about clinical experience. That is what, if I would have given chance, I would I would increase my clinical experience in USA. And if it is a university program which is more dedicated towards research, I tell that I want to do more and I want to add more into my research experience. Yeah, that's it.
Maybe you can frame it like that. If the person is giving the interview in United States and he's giving an interview for a community program, and they ask what would you like to change, so you can just say that I would like to change that. If I would have more time, I would have added more United
Yes.
States here experience, and that's why, because I cannot add it into the CV now because it's already submitted, but still I'm trying to get my United States US key, and right now I'm in United States. I'm working at this place because I try to add on more and more in my experience, though I cannot add it in the CV, but it's for my personal gain as well.
That's a good way.
And if you are in India, Pakistan, or anywhere else in the world, and you want to talk about the research in a research program, then also you can frame your answer in the same way that you did not have much time to work on more papers, but after submitting your application, you are still working on more research papers, and because you want to gain the experience. This is not something that you just want to put in your CV, but it's for your own personal and professional growth as well, and that's why you have been working on more research papers. So in this way, you can explain them both of the things. Like it's not in your CV, but it's still, you did not want this thing just to be in your CV. You wanted this thing to be for your personal and professional and personal growth.
Yeah, perfect. Yeah, that's good. So you teach us a lot. Like whenever you come, Dr. Suraj, you teach us a lot of things. Yeah.
I just get more ideas when I talk to you guys.
So yeah, Dr. Marriott, I think your question is answered as well. Dr. Suraj talked about it. Like you can just answer it this way. Yeah. So anybody else wants to give the answer to this question? Then we'll shift to the next question. What do you think money cannot buy? Yeah, anybody, like I think Dr. Mohammed Usman, like you wanted to answer this question.
Sorry, what's the question? Can you please repeat it?
The question is that if you want to change anything in your CV, what would that be?
Yes, I wanted to give it a try.
Go ahead. Go ahead.
I would say this is a great question, and I'm happy with my experiences and my challenges because I believe it has shaped the person who I am today. But if I had the chance to change, after I came to the US, I realized how programs weight the volunteering activities and how much they pay attention to it. So I would have changed one of my experiences to my volunteering activities, since I have a bunch of volunteering activities in my homeland. That's the thing that I would change.
So Dr. Mohammed, like in my opinion, you shouldn't tell them directly that since programs consider a lot of voluntary work, you should just say that since I like doing a lot of voluntary work and I have already done a lot of it, and I could mention in my CV. So if given a chance, I could add my voluntary work to my CV, and then they can shift the discussion to your voluntary work.
All right, perfect. Thank you.
Otherwise, it's a good that's a good point. Yeah. So anybody else wants to answer this question? Then we can shift to the next question. What do you think money cannot buy? Yeah, Dr. Michael, you wanted to answer. Like I think your network was not perfect at that time. If you want to give a try again, just go ahead with your answer.
I don't know if my net is good now or not.
No. Now you're audible. Like just be a little bit loud. You can go ahead with your answer.
Yeah, I am old grad, so if I know it's red flag. So my answer will be, if I could take step one at my journey to USMLE early in my medical school, this will be better chance for me. Is this good answer, or I don't need to highlight the flag that I am undergraduate?
Dr. Mike, I feel you're talking about your regrets here. So I would not advise to talk about your regrets here. So, because in the meantime, you would have gained a lot of clinical experience as well. So better just try to add on something that you are still wishing for, and you are trying to get it on your CV.
Okay, thank you.
You're welcome.
So, like, should we go to the next question? Like, if you want to buy, what do you think money cannot buy?
A residency spot.
No, it can buy, of course, a residency spot. Like,
you cannot bribe a program director for a residency spot.
Especially in some countries, you can buy a residency spot.
Residency spot in United States residence.
I think in United States only the residency spot can be bought by money, because there are many countries who are nowadays collaborating with US, like world countries, and they are literally paying for their students. So making sure some
so let's not discuss. Like, I'm so sorry
But
to interrupt.
that's not on the board. That's something
we
that
cannot
might
talk,
not.
but yeah.
We can just
that
go with the
can be done.
answers. Like, I'm so sorry to interrupt. We can just quickly finish this question. Like, I'm so sorry, Dr. Suraj and Dr. Sapta. We can just discuss upon this answer. Like, we can get more opinions about this answer. Dr. Alisa, go ahead with your answer.
One thing money can, according to me, is time. I would like to relate this to one of my experience when there was one cancer patient and he was on the verge of death, and he was in his last moment. He really wanted to meet his son, but his son was abroad and it would take him around 2 days to come to meet him. At last the patient died and he couldn't meet his son. So I mean, the patient was rich and he could spend as much as he want, but even if by spending all of his money he couldn't meet his son. So I think one thing money can't buy is time.
Yeah, that's a very impressive answer, I would say. And everyone, if you are trying to say the same answer, but just try to put some story, like Dr. Alisa added a very good story, and if I mean, I really like that answer. So just try to think something like that, and put a story as well with this answer.
Dr. Ayushman, you're on mute.
Sorry, Dr. Suraj, can you please give your answer as well?
I haven't thought about it yet because there's a new question for me. I mean, for a fun fact, I would maybe after giving a real answer, I might ask the program director that I cannot buy a residency spot at your program. That will be just a a funny answer. But apart from that, let me think. That's very good. I like Dr. Alisa's answer. Like that this is something that nobody would talk about, and she has really attached a very good scenario with that. Maybe apart from that, maybe talent and creativity.
Okay, that's a nice answer.
I think the
I don't know, but I mean,
relationships,
if I
we
go
cannot
with
buy
the
relationships as well. Any true relationships, friendships, we cannot buy from money. And a lot of rich people, they don't have actually a lot of friends, true friends and relationships. All they are left with money in them. So I think that is also something that we cannot buy from money.
Well, maybe we can try to, we can try to relate our answer with the healthcare system, something like Dr. Alisa said. So just, I'm trying to think something which should be, which can fit in healthcare as
I'll
well.
give my answer, which is not very appropriate. So you can just, by that time, you can think about your answers and we can get interesting answers, right? like, what do you think money cannot buy? Then after that, we shift to the third question. So like, I'll just give my answer. So what I think that money cannot buy is a contentment in life. A poor person, a person with a very less money can be happy and contented, but the person with a lot of money, despite despite being happy, but may not be contented with his life and want something more as well. So that's what I think money can buy, happiness, but it cannot buy the contentment.
Yeah, my answer would be similar to you. Like peace of mind will be my answer. Like, um, definitely peace of mind is not always proportional to money. I have seen many old age people being millionaires are spending a lonely life, stressful life, a sense of emptiness, spending their whole life in nursing home. So definitely they are not happy from inside, and doing lot of um, uh, uh, unwanted incidents like suicides nowadays. So mental illness is something, is the outcome of such stressful life. So yeah, peace of mind would be my.
So
We can
mine,
talk about respect and trust as well, that money cannot buy you respect and
Yeah.
trust. And then we can relate it with our healthcare system as well, that to gain respect and trust, you have to be emotionally attached with the patient, and you have to dedicate your time and loyalty to the patient. Only then you can buy the respect and trust of the patients. And I don't think so it will be a good idea that if you compare it with someone, that the rich, any rich doctor, or don't try to compare here, that the XYZ person is rich, and but he does not have any respect or trust, or he has just a fake respect and trust. Don't compare that. Just talk about yourself in that question, that you feel like that you can gain respect and trust through your dedication with your patients and with your friends or with the community. And this is something that you cannot buy with the trust, even if you are millionaire. But if you're not dedicated with your patients, then you cannot buy these things.
that's a very good answer. Yeah. Anybody else wants to answer this question? Like, what do you think money cannot buy?
I would like to add, money
Yeah.
cannot buy, in my opinion, money cannot buy health, be it physical or mental health. You have to dedicate your time and work to it. Money can also buy you some personal trainers, gym equipments, but if it's or like even a psychologist, coach, life coaches who can improve your access to this physical and mental health. But it's eventually you who has to put in the work by sweating out in the gym, or like taking care of yourself mentally by doing things you like or spending time with people you love. So these are the things which require some effort. So I believe health is something which one cannot buy.
One more question you can ask about, I mean, you can talk about your personal identification as well. That the person you are, because of your life experiences, your values, your beliefs, and your culture influences that you have been through. So this is something that you cannot buy through money. If you were millennial and you did not have such life experiences, then you would not have been the person that you are. So the personal identity cannot be bought through money.
Can I try?
Sure.
The one thing that I believe money cannot buy is eternity. That's why I believe people should spend their time supporting their community and inspiring others, because that's the one thing that is going to last in the people's heart.
Right.
Okay.
Like, would it be a good idea to mention about, like, people who have lost, you cannot bring them back despite spending any amount of money?
Yeah, that's very true, and that's like, yeah, you just have to build that with a, you just have to add an example to your answer. So yeah, you can just practice this question again, like whenever you have free time, you can just try to concise your answer and add an example to it. Right? Be it health, be it trust, be it respect. Or as you told, if you want to bring somebody who's deceased, like we have our somebody in a close relative who's very close to us, we want to bring that, but we cannot buy that with money. Right? So but just add an example to your answers.
Yeah. Thanks, Ayushman.
Yeah, so anybody else wants to add something to this question? Then we can just shift to the third question.
We can talk about intelligence level, IQ.
Sorry?
We can talk about intelligence level, like our IQ. That is also, I feel, sometimes money cannot.
Yeah, it's
Like,
definitely
yeah.
not good, but yeah.
You can talk about like wisdom is like you can talk that wisdom cannot be bought with the money. It's a product of your life experiences, your self-reflection, and learning from both success and failures. So it cannot be solely bought through financial investment.
Yeah.
I can tell something. If possible.
Just go ahead
So
with
yeah,
your
if one thing I would say money cannot buy is your self-satisfaction. As being a doctor, I have faced like multiple challenges. But recently, I was in the airline, United States, in the United airline, and I faced a medical emergency, and I treated a patient there. And in regard of that, I get a lot of appreciation, and I got also like a little email from mother and the son about how well they are doing now. He was just 12-year-old with a different condition, and I treated him during the aircraft. So that all experience, and afterwards when I got home, and I was really satisfied with myself. So I think that was very satisfactory. And yeah, so that satisfaction we can never buy from money, or yeah, that's it. Thank you.
Perfect. Yeah. Anybody else wants to answer this question? Then we can just shift to the third question, that what do you think, what is more important, respect or love? That would be our third question. So yeah, quickly, anybody wants to answer this question? What do you think money cannot buy?
I can talk about like human value also, like correlating with the COVID time. Like we have seen many premature and unwanted death, which was not expected due to like the pandemic, like COVID. That time we have learned so many things, including how to respect the human life, because life is short and unpredictable. So this is something, the human life and human value, the money cannot buy every time.
Okay. Yeah, you just want to say we cannot control our human life with the money. Okay, that's a good answer again. Like, yeah, COVID example would be great again. Yeah, anybody else wants to answer this question? Then we shift to the third question. What do you think is more important, love or respect? Then we can even take that fire question. Like quickly, we can just take, anybody wants to add something, go ahead with your answers. Like they're very interesting. Harshita, do you want to give the answer?
Let's answer about the wisdom thing. So I'm pretty sure, I mean, I am sure that money won't be able to make someone wiser, because it's up to an individual to learn from their own experiences and from other people's experiences. And of course, knowledge is always how do I say? Learning doesn't, sorry, not knowledge, learning doesn't stop. So like at any, like at every point of your life you have to learn, uh either the hard way or like through, like, I mean, from seeing other people's struggles or successes or failures, and kind of uh learn how to become a better person, something along those lines. I mean, I haven't framed it correctly, but yeah.
So yeah, Nikhil, Dr. Nikhil, you want to answer this question? Or anybody else? Do we have Ishan here to answer? Ishan, do you want to answer?
You can also add on like money cannot buy a new life. As Dr. Alisa said, money cannot buy time. And she gave the example. You can also put like money cannot buy a new life and then give the same example. Like you are working in ER or while you are working in COVID and you saw the millennials who were losing their life, who were ready to spend millions of money, but they were unable to buy a new life. So, I mean, you can frame it like that as well.
We can just add that to the COVID example. Like somebody we must have lost in a closed ones. We can, like Dr. Sapta told, so Dr. Sapta, that would be like a better answer, like what Dr. Suraj said. Like we cannot, bring back the human life that we have lost.
Yeah, I think the time example and this new life example, this would be better if someone is asked, because we can relate it to that with the health.
Yeah.
But
And
yeah,
in time also you can give like you can give the if somebody
And
is using the
also,
word time,
I feel like the
then
habit, the someone told about the health, that we can relate with the lifestyle disorders, sedentary lifestyle. The more richer people, they have the more this morbid conditions and sedentary life conditions and mental illness. So we can also relate that the habits, some good word about that.
I would not say that. Just try to relate with that. Like the wealthy people are obese or they have sedentary lifestyle. That is like you're talking negative about something, or you're talking negative about wealthier people. So
Okay.
just talk positive about yourself. That's it. Don't bring anyone negative in this regard. Like I gave the previous example as well, that with the money, you cannot buy wisdom. Though you know people who have a lot of money, but they are not wise. But you do not want to talk about that. So that's the thing that you have to be very careful while talking about such things. They always want to test you that do you want to talk negative about someone or not? So you have to keep your examples very positively and just talk about yourself, that what you think about it. That's it. Don't give any negative example of someone else, or don't compare it with someone else.
And also, I want to add, like, actually, doctor, one of the richest people in this country. So sometime maybe you met a doctor and obese, and so yeah, we try to avoid this area.
Dr. Anjali, go ahead with your answer.
Thank you, Ayushman. My answer would be that's really interesting question. Money is definitely a big part, but it's a part of life, not a life. And I would like to contradict this with the statement that money cannot buy happiness when you treat a patient, and the satisfaction you get and the happiness you get, that money cannot buy. And I would like to give an example. I was just treating a GBS patient, Guillain-Barré patient, and the patient was around 11-year-old and presented with weakness of lower limb, sudden weakness of lower limb. And after giving proper treatment, he was managed. And when he started walking again, the smile, the satisfaction, and the content which I saw on patient's parents, on the face of patient's parent, I think that's the best happiness I could ever get. And there are a lot of examples like this. And what I feel is this happiness, this satisfaction, money cannot give me. Yeah, that's it.
That's a good answer. Like anybody else wants to answer this question, then we can just shift to the next question. What do you think is more important, love or respect?
Can I give this one a try?
Sure, go ahead.
Okay. So I would like to answer this question by saying that I feel money cannot buy you a second chance at a missed opportunity. So during med school, I was fairly not very confident as a student, and I remember there was this scholarship fund that was organized by my college. And I remember everyone applying for it, and I sort of did not have the confidence to go ahead with it. And I remember people with similar credentials as me applying for it, and some of them even like got a chance to actually get the scholarship. And I was just wondering, like, there is nothing there could be done, to like, rewind the time and like get back the opportunity again. So yeah, that's what I want to say.
Yeah, Dr. Ali, you want to give an answer?
I have one more answer if someone wants to listen.
Go ahead, Dr. Suraj. Yeah, go ahead.
You can also talk about that money cannot buy the past. Money cannot change or erase whatever the memories you have in the past. Either it's good or bad, and that realize you that with present and future you have to take these things with you. So money cannot buy your past, and then you can add on some story with that. Any good thing or bad thing that you want to add, or any memory, and then you can say that you have to live with that memory. And if I could change this past, or if you could erase this past, or if you could change this thing, I mean, just try to add some story. This is something you can talk about.
Very good point. Like, if I have to talk about like past, then I can just say that my grandmother has Alzheimer's disease, and she's in a very vegetative state now. So if ever like I cannot, so money cannot buy her health back for me, and get her to the state from where she started. So I can just add that example as well. And that's even something somebody asked me, like, what do you want to change in your life? That would be something I want to just change in my life. So yeah, but I cannot do it, and money cannot do it for me. So yeah, that's a very good point. Thank you. Anybody else wants to answer this question? Then we'll go quickly move to the next question, and we can just try to cover at least 4 to 5 questions in the meeting. Yeah, just anybody like. Then we'll shift to the next question. What do you think is more important, love or the respect? Dr. Prabhan, you want to answer this question?
Vishman, you are throwing very good questions today.
No. So there is basically a list of questions that I have in the group that I've shared. Somebody shared in the group. I think Dr. Hamad shared that in the group. And so I'm just taking the questions from them, because the rest of the questions we have practiced many a times, and we know what to answer in that question. We can just polish them and work more on them. But these are the questions that we can get. Like, yeah. So I think like, yeah, we can just, okay, then we'll shift to the next question. What do you think is more important, love or the respect? Okay, anybody wants to answer that question? Go ahead, Dr. Suraj. We need to listen from you. Yeah, go ahead.
Let me think about it. Definitely, I'll go for the respect, but I'm just thinking that how can I justify that in the real answer?
Okay, so what I'll just begin with my answer, then you can just give your answers as well. So yeah, so for me, I think in my case, I would prefer love. So because in if you're loved by somebody, like be it your parents, be it your partner or your family, so that would help me to thrive and work really hard towards whatever I like, and from working really hard, I can earn that respect from me. So I think in my case, it would be love, and working that will help me to work towards my goals, and from that I can earn respect.
I can go around for the same thing. Like I would go for the respect, because I feel like that I'll earn that respect through my through dedications, through my um, being a genuine person with everyone. And once I earn that respect, and ultimately it leads to people loving you. So for me, the respect would be more than the love.
Oh, perfect. Yeah. Anybody else wants to add something, answer to this question? Like, what we would like to hear more perspectives to this question. Don't be shy. No answer is going to be wrong. Like, every answer is perfect. You can just go ahead. Yeah, go ahead, Harshita.
Yeah, I think for me, I would consider being loved better than being respected, because you can earn respect through love. So, I mean, respect is also important, but there can be an element of fear associated with it. like maybe people might not be comfortable, like, approaching you, and uh, so like for me, it's love is more important, like something along those lines.
That's fine. Yeah. Anybody else wants to answer this question?
I have a quick question. In what context they want to know this, like love and respect? Is it like a patient to a doctor relationship, or your collegial, or what?
So, Dr. R, like what I think is from these questions, they just want to know your personality. Like they don't want to hear anything like related to your medical life or something, because they know that you have excelled in your medical life. That's why you're sitting in the front in front of them, getting interviewed. But from these questions, they just want to judge your personality. That's what I feel.
Oh, okay. So that's just a general question, right?
That's a basic. That's a just general question. That what would you choose? And they just want to know your perspective. That how, like what's your thinking?
Oh, okay.
Because everybody
Can I add my answer here?
Yeah, Dr. Who, go ahead. Thank you.
So my answer would be that love and respect, they are not that mutually exclusive. Like we cannot say I love this person but I don't respect him or her. There is also an element of love when you respect someone, or you always respect that person whom you love. So they are not mutually exclusive for me. When I love somebody, I give him or her the respect, or when I respect somebody, so in some kind of like, I always like have this feeling of not specifically love, but um, I respect that person. Like they are not mutually exclusive for me. So that would be my answer. And to the another question, that what money cannot buy. So my answer would be that the impact that somebody's personality has, like for instance, in hospital settings, or in our teachers in the school settings. So somebody has, like, irrespective of their financial status, or having like how much money they have a specific aura of their personality. Like in front of you people, like during interview, there would be like hundreds of candidates, but we are not judged by our financial or the money status. So everybody has specific aura of their personality, and I guess that's something that we cannot buy with money. Like we don't show our money here, but everybody has different impact of their personality. So that would be my answer. Thank you.
Thank you so much. That's a good answer. Yeah. Anybody else wants to add something? Yeah, go
Can
ahead.
I?
Dr. Hoos, I'm sorry, I just want to say one thing for Dr. Hoos. I really like your answer that you gave, that what money cannot buy. I would just ask you that try to frame your ideas in much better way, because you are repeating some things in your answer. So just try to write your answer in a thoughtful way and try to make it in 2 lines. That's it. But your idea was really very great.
Thank you so much. This is just came to my mind right now. I haven't like worked on it, so thank you so much for the feedback. Yeah, I will work on it, like making proper answer. Thank you so much.
So next question, like we'll just take the answers for this question as well. And
Can
the
I-
last question
can I
would
answer?
be, what do you, yeah, sure, Doctor. I'll just give me a second. So last question would be, what do you think that keeps you, keeps you going? Like what keeps you going? So we just have to answer this question. Like after this, we'll go with that question. What keeps you going? Sure, Dr. R, go ahead with your answer.
I would say that I would like to be like the respect is more important to me, because I think that respect is a fundamental right of every human being, even as a child, even between your colleagues, and even between a patient and a physician. And in every situation, I think being respected and respecting other person is the fundamental right of both the sides. And on the other hand, love grows on with time. and love can take time to grow, but I think respect needs to be there as it's a very basic human right. Yeah.
Answer. Anybody else wants to give answer? Yeah, Dr. Suraj, you want to tell something? Go ahead.
No.
Okay. Anybody else wants to answer? Like before we shift to the next question? Yeah, Dr. Anjali, you want to answer this question? Okay. Yeah. So the last question: what do you think keeps you going? What keeps you going? Right.
What keeps you going?
Yeah. So anybody else wants to answer this question before we shift to the next one? Dr. Bushra, you want to answer something? Or Dr. Ayat, Dr. Mohammed Usman? Okay. Okay.
Is Om there today?
Sorry?
Is Om there today?
I think my answer would be that seeing a little progress day by day keeps me going.
No. For this question, like, okay, that would be the next question. Like, for this question, what would you prefer, love or respect?
I would say love, because respect can be associated with my post, with my rank. People are forced to respect me due to my position, but love is genuine thing, and if somebody love me, he or she will automatically respect me.
Okay, yeah, Dr. Ali, go ahead with your answer.
Okay, what I would say about respect and love is that I personally prefer respect, because I think being respected by people is something to aspire for. You don't have to look for people to love you. Not everyone will love you, but everyone should respect you, and this is shown by your ethics. When someone respects you, it means you are a professional. You are someone who has all the fundamental rights. You are someone who treats other people with respect. That's why they respect you. But I think love is not something that you search for from everyone. You need only one person in this life to love you, but you need everyone to respect you.
Okay.
That's what I would say.
Perfect.
That's a good answer. Yeah, Dr. Ashish, go ahead with your answer.
Thank you. For me, it would be respect, because respect is a fundamental trait that should be shown to people in general. Like, loving a person is not in our hands, but respecting is. Moreover, if we are in love with a person, what keeps the relationship healthy is respect towards each other. So I think respect is what matters for me the most. Thank you.
Very good answer again. Yeah, Dr. Alisa, go ahead with your answer.
I would say both respect and love go hand in hand, but if I have to choose one, then I would definitely choose love, because someone needs to genuinely like you in order to love you. But in case of respect, if you are in some high authority positions or some senior, then you are bound to respect that person, because you get some constant fear of, because they have the power that they can enforce some rules and they can even punish you. So that might also lead to respect, but that is based just because of fear. So I would say love.
Okay. Oh, that's a good answer again. So, like, should we shift to the next question, or anybody else wants to answer? Dr. Sapta, Dr. Anjali.
Yeah, I want to answer.
Go ahead.
Like, what keeps you going, right?
Like right now, yeah, we can just shift to that question after. If you want to talk about what you think
So
about
the
love,
love and respect, that one.
then we can just shift to the next question. Like, yeah.
So which question you want me to answer? Like
Right
the
now,
love.
do you want to talk about love and respect right now?
Okay, yeah, I can talk.
Yeah, go ahead. And then we'll, after that, we can talk about this. After listening to Dr. Anjali, we can just go to that. Yeah.
Okay.
Next question, what keeps you going?
So, like for me, respect is your true effort, following appreciation by many, So I would like to choose respect because most of the time it is unbiased and not forced without your true hard work. Even if it's power or position that has to be earned. So I will choose something which I am truly deserve to be. So respect for me.
Then, Dr. Anjali, go ahead with the answer. Then we'll shift to the next question. Yeah.
Thank you, Aishman. So according to me, both love and respect are, both of them are important, but if I have to choose among them, then it depends on the situation where I am in. If I am in the hospital, if we are talking about professionalism, that I would choose respect. But if I am at home, I'll give importance to love rather than respect. Yeah.
Yeah. Okay. That's a very good answer again. So yeah, anybody else wants to answer, or we should shift to next question, like the love, what keeps you going? Okay, like we'll shift to the next question, like so that we can cover 4 questions today. Yeah. Sorry. Yeah. So anybody else like want to answer, like what keeps you going in your life? You go ahead, Dr. Suraj. Yeah.
No, I'm just thinking. Let someone else start this.
Oh.
I'm thinking about
And Dr.
answer.
Sapta, you had an answer to this question, so you can go ahead with the answer.
Yeah, I can answer. I would answer this way that dream and belief of doing something impactful for myself, for society, community, and for world in a broader way. In one word, life of substance. I want to live that way.
That's a good answer again, Dr. Sapta. Yeah, so I'll answer this question, like whatever I have in mind, then we can hear more answers. Like, so what keeps me going in my life is towards my goal is definitely, like everyone, at times doubt themselves, have a self-doubt that whether they'll be able to reach their goals or not. So similarly, even I have self-doubts about myself at times, and I acknowledge them. But what keeps me going on is that I don't want to regret down the. I don't want to regret about anything 5 to 10 years later on that I didn't put my effort, in like back in time to achieve my goals. So just to avoid that regret that I didn't put my 100% effort, that's what keeps me going on to achieve my goals. Else wants to answer? Yeah, go ahead, Dr. Suraj.
Or just maybe your answer should be reflecting your whole personality, whatever you have written in your personal statement, and it should be reflecting your hobbies as well. So you can start with what keeps me going. What keeps me going in my life is my unwavering commitment to my personal growth and making an impact in others' life. So this should be your theme for your answer, that your unwavering commitment to your own personal growth and your passion your passion to make a positive impact on the community or on another person's life. And then talk about that you always seek feedbacks to make yourself a better version of yourself every day. And the other thing that you want to make a positive impact on the patient's life, then take something that what motivates you from there. I might say that I might be saying that I'm a people pleaser person, so that's something that keeps me going to make a positive impact on the community. And that this is what keeps me driving, that I should be doing something better for the community.
That's a good answer. Yeah, thank you so much. Anybody else wants to answer this question? Yeah, you want to go ahead, Dr. Suraj, and you want to add anything?
No.
Okay. So yeah, Harshita or anybody else? Dr. Amrit, you have switched on your mic. You want to give the answer? Anybody, like, it can be like, don't be shy, like you can give your opinion on this answer, that's fine. No answer is completely right and no answer is wrong.
I can give a try.
Sure, go ahead, Harshita. Yeah.
I would say that my motivation to do better and my family's unwavering support keeps me going. Yeah, I think that's it. Don't have anything else to say. Like, what else can we add? Like, do we need to like give some example or something? Or
Like, that depends upon you at that moment, like if you want to give an example or not. Like, I don't think like you need to add example to every answer you speak, but and moreover, this question would be kind of a very impromptu. They would be expecting a very impromptu answer from you. So yeah, if they ask like, do you have an example to that, then you can just come up with the example. Otherwise, I don't think like you need to give an example to every question. Else, Dr. Suraj can add something to this.
Hi, Ayushman. Can I say something?
Yeah, go
Just
ahead, Dr. Agya. Yeah, go ahead. Thank you.
yeah, I think the new experiences that that I'm willing to gain, it keeps moving me in my life. Like there is always something new to discover, like new music, be it new food or, like new places or new cultures. I think that's what keeps me moving. So yeah, I think that would be my answer.
Yeah. So anybody else wants to add give their answer, like whatever you have in your mind? Yeah, Dr. Ali, go ahead with your answer. Yeah, thank you.
Okay, I would say what keeps me going are three main reasons. The first one is my continuous sensation that I need to improve myself. There is a saying that goes, you should never arrive. You must always be in a state of becoming. And I've been living with this saying. The second reason is my feeling that I need to provide my family, that I need to give my family a better life, a better experiences in this life, better than the ones that I had. And the third reason is my ethical commitment and my feeling that I need to give back to my community. I need to give back to my surrounding. And these are the main three reasons that keeps me going.
That's a good answer. Yeah. So, Dr. Ashish, go ahead with your answer.
Thank you. So I would consider myself as a person with a positive attitude and optimism. So I think what keeps me going is my hope towards achieving a good quality of life with my family and friends being around, and at the same time achieving my professional growth. And I'm excited that slowly things are turning out in favor as I'm interviewing with your esteemed program, and I dream to achieve my goal through your residency program, and I'm excited to be in this journey.
That's a good answer again. Anybody else wants to answer this question or any question you want to answer? You can just use this as an opportunity. Like somebody yesterday wanted to talk about their weaknesses. Anyone? We just have still 7 minutes to end this meeting. We'll end at 10:30. Anything you want to add? Dr. Surya, you want to give an answer to this question? Okay, yeah, Dr. Ali, go ahead. Go ahead. Yeah.
Okay, I would like to answer the question, what are my weaknesses?
Yeah, go ahead. Go ahead.
So I would say that one of my weaknesses that I get too emotionally involved with my patients, and I carry their burden around with me when I go back home. I remember during the COVID-19 pandemic, I had a patient in the isolation who was an elderly man complaining of shortness of breath. At that time, we didn't know what was going on with him, and the patient went into suddenly cardiac arrest, and we had to try resuscitation on him, but unfortunately, he didn't make it. And that experience actually made me feel helpless against that disease at that time, because no vaccination and no treatment was yet invented for it. But when I sat down and I reflected on the reasons why I took that job as an emergency medical officer to help people as much as I can, and I talked to some of my seniors and some of my mentors, I had to pick myself up so I would take care of the next patient. And this is what I have been doing since that. I know that I will be emotionally involved with the patient, but I have to keep a certain distance so I could treat the next patient coming to the hospital.
Okay. Yeah, Dr. Lisa, if you want to answer that question, you can go ahead with your answer. Then even I would answer that question as well.
No, I haven't made any answer, but I wanted to discuss that since it was asked in the interview. That's why.
Yeah, we can. I know that Dr. Nisha yesterday tell we can take up that. That can be our first question tomorrow. Like, if there's an accidental fire in a house, how would we handle that? Yeah, right now, anybody wants to answer any question, like, or even like what keeps you going? You can just go ahead with your answer. Dr. Lisa, do you have anything to talk about what keeps you going? Or Dr. Anjali?
I think my answer is similar to the answers others have given, that I want to make a positive impact in life of others and want to give good life to my family. That's why I think that keeps me going as well.
Okay, that's perfect. So anybody else like wants to answer something to any question you want, even like tell me about yourself, you can go ahead with that. We still have 4 minutes to go. Yeah, Dr. Anjali, go ahead with your answer.
Yeah, thank you, Ashman. So that's a really interesting question. I would say that I've always, I have been satisfied with a lot of things, but I have never been satisfied with the knowledge I have gained, and that keep me motivating every day. Like every day when I wake up, I always have this thing in my mind that I always gain new knowledge every day, and this thing keeps me motivating. If ever I'll get residency spot or not. But the only thing I would never give up is gaining new knowledge and trying new opportunities. And I think that keeps me motivating and I'll till my life. Yeah.
That's a very good answer. So yeah, we just have like 3 more minutes. Anybody wants to answer anything? Like any 4 questions we discussed or anything apart from that? You can just use this 3 minutes. Otherwise, we can end the meeting. And we can tomorrow come up with some interesting questions as well. Like you can just post the questions in the chat box or in the group as well. We can take up those questions. First one would be the fire question, definitely. And then after that, we can take 3 more questions. Should I end the meeting? Then like we can meet tomorrow at around 9, same time.
Dr. Aisman, I have a question.
Yeah, go ahead.
So thank you for hosting this meeting. This was my first time and I really learned a lot. So how can we attend this meeting from tomorrow onwards? Because I don't know, I got a Zoom link from one of my friends and I want to like attend this meeting regularly.
Okay, yeah. So it's a recurring link that you can use every day. Like it's given the group description. We just meet at 9 p.m. IST, and the timings are even mentioned in the other time zones as well in the group description. You can just use that link to join the meeting anytime.
Thank you so much.
And plus, we'll be sharing the recording. Also, Dr. Surya records every session and puts up on his YouTube session. So YouTube page, so you have access to that anytime. Yeah, go ahead, Dr. Mustafa.
No, thank you. So.
Okay, so I will be ending the meeting. Thank you so much, everybody, for joining, and have a good night or day, depending on your time zones. And tomorrow, let's meet each other and we can discuss, 4 more interesting questions. First one will be the fire one, and then we can take another 3 questions. So yeah, thank you so much, and have a good day, night. Okay.
Thank you. Thank you so much.
Bye bye.